The education minister outlines the government's back-to-school plan, and it is now clear there is a shift from controlling COVID in schools to living with it. Alarm bells won't be sounded until 30% of students and staff are absent.
In the past, an entire cohort of children would have been sent home for 2 or 3 positive cases in a class.
Not anymore. In fact, alarms will only be sounded once 30% of students and staff at a school are homesick, above normal absenteeism levels. It does not mean the school will close. If there aren't enough staff, retired teachers and student teachers will be called in. Returning to remote learning will be a last resort.
By the time there's a 30% absenteeism rate among students and staff, is it already too late? Is it just ripping through the school?
I think that's a fair assessment. 30% obviously means that lots of people have brought it into the school and caught it at school. This is an incredibly contagious virus. It's on the level with measles, which is the most contagious thing we know.
The province maintains it has sent enough HEPA filters and masks to all schools, and elementary students will each receive 2 rapid tests to be used if they become symptomatic. An emphasis will now be placed on school vaccination clinics because only 47% of students aged 5 to 11 have had their first dose. The government hopes to have some up and running by next Friday. They were careful to point out they will not be mandatory.
We're going to make sure that the kids get vaccinated. We've sent out the permission slip, so when the kids bring home the permission slip, parents, or when you have them, please sign them. Please sign them and get them back, and we're going to be vaccinating the kids in schools.
I hope that he meant it. It's something that we've been pushing for some time to make it easier, more convenient, and hopefully more speedy.
The Chief Medical Officer of Health emphasized the shift in managing school cases is because Omicron is milder than previous strains.
The risk of hospitalization is very, very low in Ontario for children.
I think that's in contradiction to data from the UK, data from the US in particular, that has shown an alarming rise in hospitalizations. There's no question that kids are getting clobbered. This virus is now moving into the upper respiratory tract. That's good news for adults, but because it's upper respiratory tract, that seems to be what's really making inroads with kids, and it's going to hit a lot of kids really hard.
Now, I have to tell you, the government has sent out a clarification after a lengthy tech briefing and news conference. Not once did the government say or clearly mention that there will be new reporting on the provincial website so parents can look at it at daily data to see if there is an outbreak at their school before a 30% absenteeism rate is reported. They waited a couple of hours to clarify, but that website where parents will be able to look it up on the schools, it's not going to be up and running until the 24th. Add to that, the Chief Medical Officer of Health has had to release a statement assuring everyone the vaccine is safe for young children. During the news conference today, Dr. Moore said they want more experience with it before mandating it. At a time when parents are desperate for information, today was a communication failure.